Thank you so much for joining us today. I'm here with Jerome Lothridge, our Secretary of Health, Dr. Casey Strom, our Secretary of Science and Technology, Tim Pierson, the President and CEO of Integris, and Sean Bauman, the President and CEO of ME Labs. Thank you for joining me today. I want to give you an update on how we're doing with our fight against COVID-19. We're here at Integris Baptist Hospital and on Portland Avenue here in Oklahoma City because this is the site behind me that plays a key role in our hospital surge capacity plans. If you remember, we talked last week about our comprehensive hospital plan. Oklahoma, we are still in great shape when it comes to hospital beds, ventilators, and ICU beds. We currently have 325 people in the hospital across the state of Oklahoma. That number peaked at 560 back on March 30th. And for the last 2.5 weeks, we have continued to trend down. However, I want you to know that we are still preparing for a surge. We do not expect this to happen, but we are staying proactive just in case it does. If we need additional capacity, Integris Baptist Medical Center, Portland Avenue, has stepped up to be our COVID flex location here in Oklahoma City. This will go along with the OSU Medical Center in Tulsa. We are so grateful to our hospital community for partnering with us to provide Oklahomans the care that they need. I'd like to invite Tim Pierson, the President and CEO of Integris, to give us an update and to say a few words. Tim?
Thank you, Governor, and good morning. As was mentioned, I'm Tim Pierson, the President and CEO of Integris Health. As Governor Stitt shared, Integris is pleased to have the opportunity to partner with the state during this time of crisis. We are here today to announce the state's Level 2 surge facility, one of them. The Tulsa one was announced earlier, and today the second one will be here, operated by the state. Last week, the state officials contacted me after they heard that we were consolidating patients from this Portland campus here at Baptist Medical Center to our Baptist Medical Center Northwest campus, and wondered if they could use some of the beds that we do not use. We, of course, were happy to do what we could do to help. We're very engaged with the governor and his team on the Level 1 surge plan. And because the Baptist Avenue Portland campus is such an important part of what we're doing at the Baptist Medical Complex, we said that there's a way for us to use these beds that aren't being used to help the state. So, as mentioned, 110 beds at this campus, the Baptist Portland Avenue campus, will serve as Oklahoma's Level 2 surge facility. This partial bed lease will be accomplished without disruption to normal operations at our Baptist Portland campus here. Safety is our #1 priority, and patients who seek COVID care, non-COVID care here will be able to receive the safe care that they've always been able to receive. If we do continue to see a surge, then once the 140% capacity at each of the hospitals comes into place, this hospital will be activated. And as I said earlier, we're very pleased to work with the governor and his team. I will mention Secretary Lothridge has been instrumental and is working tirelessly as a wonderful public servant to help make these things happen. We're grateful to participate with the state in serving the community needs. It's very consistent with Integris Health's not-for-profit mission to serve people in the ways that they need to get their care. So thank you very much, Governor. We're pleased to participate.
Thank you so much, Tim, and thank you to Integris for partnering with the state of Oklahoma. You are doing a tremendous job. I had a call with President Trump yesterday, and we talked about the White House guidelines to get our country safely reopened. And let me be clear, I know how badly many of you want to get back to normal, get back to a normal way of life. We will continue to make decisions based on the scientific data and the information that is happening on the ground here in the state of Oklahoma. We'll also make decisions based on the advice from our health professionals. Our cases are trending down and our curve is flattening. That is great news. Two of the main keys to getting Oklahoma back open are enhanced testing and contact tracing. Last Friday, we were in Tulsa and heard that some of the Tulsans could not get tested or were having a hard time getting COVID tested. I'm here to tell you we have the testing capacity in the state to test anyone with symptoms. That's why we are standing up 2 more mobile testing sites in Tulsa. One's going to be located at the OSU Medical Center, Health Science Center, and one is at the OU Center for Health. Those will start on Monday. Those sites will be open to anyone showing symptoms of COVID-19 or who have been exposed to anyone who tested positive for COVID-19. You will not need an insurance or a doctor's referrals to get tested at those sites, but you may want to call 211 just to find out more information and their exact locations. We're also making great progress on antibody testing. That's a test that shows if you've been exposed and you have started to develop antibodies, and even if you didn't have symptoms, it's going to show that you've been exposed. So I've got Emmy Labs in Norman has been a great partner with the state of Oklahoma, and I've asked Sean Bauman, who's the CEO and president of Emmys, to give us an update on the antibody testing. Sean, can you come up and give us an update?
Thanks. Yeah, I've had the great privilege to work with the Governor Stitt's team on developing this new test for new blood test for antibodies that tells people if they've had an exposure to this COVID-19. So we're excited to be able to offer this testing service to Oklahomans. Oklahomans is our priority. We provide the testing service, but we also are setting up partnerships all across the state to expand access to this critical testing need. So my team has been actively involved. We've had lots of partners to be able to make this happen in a very, very short period of time. This test, I think, is going to be really important to help us understand where Oklahoma is in the epidemic. Oklahoma is in a unique position because no other state, to my knowledge, has had both of these tools at their disposal as they head towards the peak of the epidemic. So it's been a great privilege to work with Governor Stitt and his team and the folks at the Oklahoma Department of Health. Thank you.
Thank you, Sean. We're so proud of you. What a great company and entrepreneur here in Oklahoma that's stepping up to help curb this and give us more data as we all get back to work. So we really appreciate what you're doing. You know, antibody testing is really going to play an important role to give us data, to give our modelers data, to get Oklahomans back to a more normal way of life. I'd also like Dr. Casey Strom, she's our Secretary of Science and Innovation, to explain a little more about what we're doing across the state. So, Dr. Strom, can you give us an update, please?
Thank you, Governor Stitt. Oklahoma continues to make strides in our testing and reporting. Antibody testing is a component of our testing capabilities, and as I said earlier this week, we worked closely with Emmy to develop those capabilities. Antibody testing determines that an individual has come in contact with the virus and mounted an immune response. The test does not determine immunity, but it may indicate decreased risk. The test is not intended to be a diagnostic tool, but it is very helpful to us as we look at the prevalence of infection within the population. The Oklahoma State Department of Health, in partnership with the Oklahoma Blood Institute and Emmy, completed its first surveillance test of approximately 1,000 Oklahomans. Samples were received between April 2nd and the 9th from 21 cities across 17 counties in our state. The presence of antibodies of COVID-19 was 1.4%, which would suggest that during that time period, there was not a wide spread of infection of COVID-19 in Oklahoma. That means we're doing a good job with our social distancing. We will continue to utilize the antibody testing as a surveillance tool in looking at the general population and in special populations in our state, such as long-term care facilities, as well as essential businesses that, if an outbreak occurred there, could create hardships for the overall population, as well as in our healthcare workers. As of 4/16, we have tested 33,545 individuals through PCR testing, which is the nasal swab testing, with 7% testing positive. Soon, OSU Lab will be validating the use of saliva for PCR testing in the near future. We're very fortunate to have a world-class laboratory such as Emmy that manufactures and distributes innovative lines of diagnostic tests and reagents for infectious disease right here in Oklahoma. We ask that you all continue to be patient. We appreciate your patience to this point, but be diligent in your social distancing, practice good hand hygiene, and wear masks in public as recommended by the CDC. Thank you. Governor.
Thank you, Dr. Strom. We're also starting to be laser focused on our nursing homes and our long-term care facilities. That's where a third of the deaths, of the 136 deaths in Oklahoma, have come from. We know our elderly Oklahomans and people with underlying health conditions are at a greater risk, and we will continue to protect them even as we allow our healthy Oklahomans to begin the process of returning to work. I've authorized the National Guard with teams from the State Department of Health to be able to quickly respond to any nursing home outbreaks. We've called up some medics and decontamination experts who will work to clean those facilities and train their workers if needed. I'd like to have Secretary of Health Jerome Lothridge give us an update as well on what we're doing with contact tracing.
Thank you, Governor. There are really two components that we're taking into account as we prepare to think about how we get Oklahomans back to work. One of them we've already referenced through Dr. Strom and through Sean Bauman, and that is testing. And so testing both with respect to PCR and antibody testing. The second key component is contact tracing. And as the name might imply, that is the process by which individuals who have tested positive are contacted and then are walked through the last several weeks of their individual personal contacts to help us determine where it is that the virus may have been spread. This is an important part both from a public health standpoint and as we think again about putting people back into the workplace. This work, which we refer to as really the shoe leather epidemiology, this work is carried out in a couple of ways. The State Department of Health, both through its epidemiologists and through others who have been brought on board, including nursing staff, conduct such contact testing and tracing as we speak. But today we announced that we are also pulling in medical students at both of our state's facilities, Oklahoma State University and the University of Oklahoma, medical students who will be able to help in the process of contact tracing. I think this is evidence that Oklahoma continues to innovate as we confront this COVID crisis.
Thank you, Secretary Lothridge. I want to stress that the White House guidelines for reopening focus on testing and tracing. In Oklahoma, we are committed to doing the exact same thing here. The President said yesterday that this strategy is based on hard, verifiable data. We have been making decisions in Oklahoma based on scientific data and what we're seeing on the ground here, not what we're seeing in other cities and on the news. We're working with the health department on guidance for businesses to get open safely. If our positive trends continue, we hope to share more details next week about how to roll that out. I also talked with Dr. Fauci yesterday, who you've probably seen on TV. He stressed that the White House guidelines are a very measured response. He stressed governors need to act on the data they're seeing in their respective states. The president called on Americans to do their part as we continue to fight this virus, and I'm asking you, Oklahomans, to continue to do the same. Continue to wash your hands frequently, telework where you can, stay at home if you're sick, and maintain social distancing in public. I am committed to protecting our most vulnerable population, but I'm also committed to protecting the hardworking Oklahomans who are struggling right now to pay their bills and they're ready to get back to work. There is light at the end of the tunnel, and we are going to get through this. So God bless you, Oklahoma. Thank you so much, and we'll open it up to a few questions now.